The tap in for Tiger. We thought we'd never see it.
Why did he win?
Because he's Tiger Woods.
Tiger Woods. Tiger Woods. I like him.
He's not on the narcotics or the muscle relaxants, maybe even fewer anti-inflammatories, and so he can focus better.
Absolutely.
His head isn't cloudy from all these pain medications. He's not distracted from the pain that he's having.
I got bones, I got bones, I got 206, I got 206, I got.
Hey guys, Doc Mirza here, orthosynthesis, orthopedic surgeon in the Bay Area. There's an unusual, interesting tournament coming up with Tiger Woods and Phil Mickelson. And why is that interesting? Well, think about this. How many surgeries has Tiger had?
Tiger Woods. Tiger Woods. I like him.
How many injuries has he had? He just won a major tournament. He's coming off of that, going into a head-to-head tournament against Phil Mickelson, psoriatic arthritis on medication, going head-to-head against multiply operated Tiger Woods, coming off a major tournament. Boom! That's going to be interesting. But today, we're going to talk about Tiger Woods.
Tiger Woods, y'all. Tiger Woods, y'all. It's all good, y'all.
In order to address this, I brought here with me one of my friends and a renowned orthopedic spine surgeon in the Bay Area, Dr. Kris Okumu. Kris, Dr. Okumu, let's talk about Tiger's spine.
Dr. Mirza, let's talk about Tiger's spine. So Tiger Woods is an exceptional athlete. He's a transformational figure. You know, when I was in college, we were hearing about this guy at Stanford who was an amateur, who was making waves, and people were saying he's pretty good. And that guy is Tiger Woods. And as you guys know, these world-class athletes, a lot of times are playing through pain. He's played with pain and injuries throughout his career. You know, he actually won 5 or 6 championships, 5 or 6 PGA Tour events, and a PGA Championship in 2007 with a ruptured ACL. You've had a ruptured ACL. Can you imagine playing a golf tournament at that level? He did that. So Tiger's actually had 4 back surgeries. Okay, so the first four
Back surgeries.
4 surgeries. Okay, and the first surgery he had is what's called a microdiscectomy. So here's a little model of the spine. Okay.
Whoa. Microdiscectomy? What is that? Tell me what that is.
Let me go for anatomy first, and then we'll talk about what the surgery is. So this is a model of the spine. Okay, looking at it from the side, looking at it from the front. These are vertebral bodies. Okay, these are the bones in your spine, and in between each one of these bones is the disc. And think of the disc as a shock absorber. Okay, so that disc on the outside is a very fibrous, kind of tough part, and the inside is this gooey sort of center.
Just because it goos doesn't mean it's gush.
That's what these discs are like.
It's kind of like a jelly donut.
A jelly donut? Sir, yes, sir.
Like a jelly donut.
Yeah.
That's another analogy.
Yeah.
Okay? So, in the back of the discs, there is a little weak spot in all of us. Just that's the way we were made. And that's usually where disc herniations happen. And the way the herniation happens is you have a tear on the outside of that fibrous part of that disc. Okay? That tear then can allow the inside of that disc material, that little jelly donut part, or the inside of that chewing gum, to squirt out. Okay? When that disc herniates, it can come in contact with these nerve roots, which are coming out of your spine and go down into your lower extremities. These nerve roots form a big nerve called the sciatic nerve, and then they split up again. And that pain that people get when that disc material is pressing on those nerves, people commonly call that sciatica. Okay?
So, Kris, this is the front of the spine, right?
Yes.
Okay, so if someone's looking at it, their belly's over here.
Correct.
This is the front of the spine. This is the back. These are the bumps,
Yep.
right? Okay, so these little things right here, these are the nerve roots, right?
These are
Those
the
are the
nerve-
nerve roots coming out. So
Exactly.
tell me where the disc goes out. It goes out that way?
Yes, exactly. So the disc comes out what they call posterior laterally. So it's in the back, off to one side or the other, and that's exactly where it will contact the nerve. So it's called a posterior lateral herniation, usually what happens. So to relieve the pain that the person's having that's shooting down the leg, that sciatica type pain, to relieve some weakness that they may have because of the nerve being pinched, you have to take that pressure off the nerve. And the way you do that is a procedure called a discectomy. And for somebody like Tiger Woods, and for most people, we do a procedure called a microdiscectomy. What that means is, instead of the traditional way of doing a discectomy, a big long incision, stripping away all the muscle off the bone, looking at this bone, drilling out bone, removing some ligaments that are on top of the nerve root, pushing the nerve root to the side, and then plucking out that disc fragment. For a microdiscectomy, you make yeah, exactly. For a microdiscectomy, you make a much smaller incision. It's just a few millimeters, and you successively dilate tubes over the area that you want to operate in, essentially spreading the muscle apart instead of cutting through it or having to dissect it away. Then you bring a microscope in and you operate through a tube, essentially. So you're looking through a tube that's about 2 centimeters in diameter. You operate through this tube, you drill out a little bit of bone, you take out the ligament, you essentially do the same operation, but you're not splitting the muscle so that there's no scar tissue or less scar tissue that forms afterwards. Because the number one thing that golfers ask me when I'm going to do surgery on them is, what's it going to do to my golf swing? Okay, so for Tiger, he was offered a microdiscectomy. Unfortunately,
Wait, so let me interrupt here. Wait, you make a hole
Yes.
in your spine.
Yep.
You take out a bunch of jelly.
Yes.
What's stopping the rest of the jelly from going out and squirting out all over the place, through the hole, all the way out of the skin, especially when you twist? Like that golfer, like you're twisting like this, you're twisting like that, and you're telling me you're taking this bone and you're pushing it around and sliding something in? Explain to me, like, how does Tiger Woods play after taking a little bit of jelly out of his disc?
So you've actually brought up some really good points, actually. So first, yes, you brought up a point of how do we know that this material is not going to come back out again. Firstly, during the operation, you probe the disc to make sure that there's no loose material that may come out later. There's about a 10% risk of a reherniation occurring. In other words, a disc herniation happens at the same level. And that's exactly what happened to Tiger Woods, because he ended up having another microdiscectomy. Now, you were asking...
And how many years apart was that?
I think it was just the next year, I think it was.
Oh, wow.
I
So
think
it
was
can
next year. It can
happen
happen.
relatively soon. Now, is they more likely to do that because he's Tiger and he's putting so much stress on that? Because I can imagine, you know, just like walking is 3 times body weight we're putting through our hips and knees. Like, there must be so many forces going through our spine. And just to put it in context, I mean, you have joints up here and these facet joints and these intervertebral connections. There's a lot of forces going through here, correct?
Correct.
So, and Tiger is probably putting, I don't know, multifold load through the spine. So is he at higher risk as a super athlete to reherniate, or I don't know, do we know that information?
I don't know if we know that information. So firstly, think about this. When you talk about, when people discuss technique when it comes to boxing, when it comes to baseball, when it comes to golf, that rotation that you do, most of it actually comes from your hips, right? So there is some rotation in your spine, but you're mostly rotating from the hips. You generate force in that kinetic chain from the ground up, going through your foot, your ankle, your leg, your knee, your thigh, your hip, through your trunk, up to your arm, to the golf club, and then you swing. So there is some rotation that happens in the lumbar spine, but a lot of rotation happens at the hips. Now, the thing is, what I'm trying to say is, I'm not necessarily convinced that it was Tiger's golf playing that caused the herniation, because there are lots of people that get disc herniations, especially at this level. Okay, this is the L5-S1 level, and if you look at this, this is the L5 vertebral body. This is the S1 vertebral body. The angle is pointing down. A lot of shear on that one. That one is the most likely one to herniate. So yes, you can have rotation, but you know we all rotate. But that weak spot is where those herniations happen in everyone. But I'm not convinced that that's what caused the injury. However, he did have a 10% risk of a reherniation. He got one. They repeated the procedure. He then had a third procedure, which number three, and all they said was to relieve pressure. So I believe what they did is they went back in and enlarged the opening for that nerve to give it a little more space, take out any bone spurs that might have been pressing on it. And they didn't mention it was a third discectomy. I don't know how much disc was left in there after that second herniation. Usually when that happens, not much disc left, and that space starts to collapse and collapse. And then you no longer have just nerve pain. Now you have back pain from the bone rubbing on bone, and you have back pain from all those muscles in your back spasming, trying to control the pain generator.
Yeah, so let's go over that a little bit. So, I mean, we see the spine, but there's muscles all around here, correct?
Exactly.
So there's muscles all along the front.
Yep.
Okay, even though you've got your belly here, there's muscles on the front, there's muscles all along the back. So they're pain generators as well.
Absolutely.
And so these nerve roots, they're also giving little nerve fibers to those muscles too.
Exactly.
So those are pain generators. Then you have the bone.
Right.
Like you're getting bone grinding on bone causing pain as well because there's nerve endings in bone.
Exactly.
That's a lot of pain.
Essentially, it was that disc degeneration that finally caused Tiger to stop playing golf because that's how much pain he was in. I assume he played through an ACL rupture. He played through tibial stress fractures. Well, he actually stopped, after having the stress fractures. But he was able to continue for a while with these things.
Tibial stress fracture.
Yes.
He had a tibial stress fracture.
Bilateral tibial stress fractures. Yeah.
So it wasn't. He was still able to walk on it, right?
Still able to walk.
We'll go over stress fractures. That's a whole other segment that we have, but that's pretty significant. Spine, tibia, knee, ACL. Biggest issue is his spine. He probably had a lot of pain.
Tremendous amount of pain. In fact, people who have these problems are often taking anti-inflammatories. They're taking narcotic medications. They're taking muscle relaxers. Anything to relieve them of their pain.
Aren't a lot of our muscles there to help splint? They're like an internal splint to our bodies. So if we relax the muscles, we become all loosey-goosey, but couldn't that hurt us more? And doesn't that have some mental side effects as well? And then you're taking all these painkillers. That can really affect you in your professional life, your personal life. So that can have a lot of impact on a pro athlete.
Absolutely. So yes, all those muscles, the internal muscles that you're talking about that line the spine, the back muscles that attach to all these bony prominences, your abdominal muscles all act like a brace. Okay. Problem is when people have back issues, all those muscles try to now brace the back so it moves less and they spasm, and that's what hurts for a lot of people. So in addition to the pain they're having from the pain generator that's actually source of the main pain generator, they now have the muscles that are also causing pain. That's why muscle relaxers help, because you relieve those spasms. Unfortunately, just like all medications, they're going to have side effects. It's going to affect your cognitive abilities. It's going to affect the way you function. And nobody really wants to be on pain medications for the rest of their lives.
So you've told me that some of the times these patients come with so much pain that they are so aggravated by the pain that they're almost willing to do anything. By the time they see you, they have been through the gamut of pain relievers, narcotics. They're tired of it. What do you do?
Absolutely. It's a conundrum, because the patients come to you as a spine surgeon and you're usually their last hope. They've been being treated conservatively by their primary care physicians. They've been seeing pain management doctors. They may have had previous surgeries, and so they're coming to you hoping that there's an answer to their problem. When I'm able to help a patient, that's a great feeling. When you can relieve a person of their pain, give them back their life, that's fantastic. But there are also times when you have to be honest with the patient and say, you know what? I don't think surgery is going to work for this condition, and it could actually make you much, much worse than you were. Fortunately for Tiger, there was surgery that could help him.
So I want to go into that, okay? And I wish we had a model that would explain what he had done.
Well, look at that. We do have a model.
Oh, what is this? Looks like a nice little keychain here. Yeah, what is that? Looks pretty fancy.
So this is called an interbody cage, okay? And this is something that was used in Tiger's surgery, or something very much like this. So what happened with Tiger, as we were talking about, is he had three previous surgeries. His disc had most likely completely collapsed. He was having back pain in addition to some of the leg pain. And that leg pain may have returned because as this collapses, that little window for this nerve to come out also collapses. So that makes less space for that nerve. The nerve's irritated again. And he kept on talking about nerve pain. So he had pain from the disc degeneration, and he still had the nerve root pain, so the sciatica. So at that point, what needed to be done is take out whatever remaining disc was there and try to restore the anatomy as best as possible. And he ended up getting what's called an anterior lumbar interbody fusion. Okay? What that means is they went in from the front, incised the muscle.
Wait, whoa. Wait, going in from the front. Wait, I got some important parts in the front. I've got my belly. What's going on? How can you go in from the front?
All right, so this actually is a very good way of doing this surgery for somebody like Tiger, because remember, all these golfers always wonder what's going to happen to their swing, and I don't want to do anything to those muscles in the back. Okay, so a nice way of
because that's postural retention. You want them to be able to be straight up, and the thicker muscles are on the spine are in the back. Is that correct?
Well, it's not just that. It's just that if you do a posterior surgery, you can do it minimally invasively, but you're removing a lot more bone. You are going to devitalize some of the muscle that's there, and you can only get a certain size implant in if you go from the back. A better way to do it, especially at this level, L5S1, that level that's pointing down, has all those shear forces on it, is to get as big an implant you can have inside there so you can get a good big surface, a nice broad surface to get a fusion across there. Okay?
He said bigger is better. Did you guys hear that? I heard that.
Bigger is better sometimes. So, anyway, so what they did for Tiger, and this was done at a place in Texas, it's pretty well known, is they went in anteriorly, so they made an incision, and they said they did it minimally invasive, which means I think they just use a smaller incision than normally. But you make a small incision, you don't cut through muscle. You pull the muscle to the side. Okay? Pull the muscle to the side, and you dissect down until you get to the spine. Once you get down to the spine, you open up that disc, or whatever's left of it, remove all of that disc, and then you fill one of these cages with bone graft. Okay, and like I said, he had a cage.
And where do you get the bone graft?
So back in the days, we used to take bone graft from the patients themselves. In other words, we'd take make a little incision of their pelvis, take out what they call iliac crest bone. So it's right around here. The pelvis is up here. The problem with it, and it works great. Okay, people heal, and it's kind of the gold standard when you're doing fusions. The problem with that is about 50% of people have pain from where you took the bone graft.
And that's often worse than sometimes the surgery
Exactly.
itself. The bone graft side is often worse.
Exactly, yeah. I'm not saying I've said often, but enough times people would say, my back feels great, but what the heck is going on here? Right. Okay, and that may not go away. So,
and that's where people put their belts,
exactly.
They wear their pants,
Exactly.
like there's a lot of irritation,
very sensitive area.
Yeah.
So there's lots of biologic agents that we can use that can have just as good of an effect. So we use cadaver bone. There are some special proteins that we can add to that allow the bone to fuse even faster. But this cage, and I'm probably certain they use something similar to this because this is made out of a titanium alloy. Titanium alloys are used in joint replacements. They're used in dental implants and so forth. But the thing about titanium is it's similar to has a similar structural properties to bone in terms of stiffness, and bone likes to grow into titanium. So something like this was probably filled with bone graft and then inserted into that disc space like so. Okay? And when it does that, it's restored these pyramidal dimensions, so the nerve is not being pinched anymore. The bone fusion is going to occur from this bone to this bone and form one solid bone. Is that going to affect his range of motion? Remember, most of the rotation happens at the hips. And that level of the spine, there are some people who are actually born with one less lumbar vertebra or one more. Mm-hmm. So if you're fusing that lowest level, it doesn't really affect your range of motion very much at all. When I heard Tiger Woods was having this surgery, the first thing I told people is this guy's going to win a tournament within a year.
The tap in for Tiger. We thought we'd never see it, and I don't believe he thought either. Tour championship winner, Tiger Woods.
Isn't this going to fall out? Isn't it going to pop out?
Yes, so you've put that in there, and yes, you have to worry about this thing popping out. Now, this actually is 3D printed, and there's kind of a rough surface on there, so it gives it a little bit of stability, but that's not enough. Remember, this thing is pointing down, he's going to be doing some rotation. So you have to stabilize it some way. So one way of stabilizing it is if you hand me that model there. One way of stabilizing this, and this is a 2-level lumbar fusion. One way of stabilizing it is from posterior, putting in screws in the back, and these rods that sort of act like the scaffolding that you see outside of buildings that are being built. So they kind of provide structural support while this bone fuses. However, all those back muscles we were talking about,
right.
I bet they didn't do it this way, and they don't have to do it this way. So I probably would have not done it this way. I don't think his surgeon did it this way either. What he probably did is, as you can see in this implant, there's some screws that are going into the vertebral body that are holding it in place. I imagine that's probably what Tiger Woods' surgeon did to prevent any damage to the muscles in the back, because that provides stability. What he may also have done is put a metal plate on the front to keep this interbody implant from popping out. So the option of stabilize this thing and fixing it securely from the front as opposed to putting these big screws in the back is probably what happened for Tiger.
Okay, so he may have had it just, so you could actually do it just with the cage in between.
Exactly.
In some cases,
Exactly.
if you have good stability.
Exactly.
But you could supplement or augment by putting supplemental screws in, or worst case scenario, it's almost like 360-degree operation. You go in from the front, then you go in from the back, and you do this. But this is unlikely because that's probably too much muscle dissection for a pro athlete.
Correct.
And like you see here, there's screws going up there. Okay, that's a great explanation and understanding, but why did he win?
Because he's Tiger Woods. And because he was now not playing with as much pain as he was having before. Think about that. He continued to play after having those microdiscectomies. He continued to play after having that laminotomy. And it took a while for him to finally break down after that disc had completely degenerated. So now he comes back, he's free of pain, or at least in much less pain than he was before. He's probably had to adjust his swing a little bit, but he's Tiger Woods. It's all those 10,000s of hours of preparation that got him back to where he is again.
That makes a lot of sense. So, getting back to these athletes, they're mentally tough. They want to get back into the game. They love the game. They've been doing this for years. They've got this muscle memory, and whether you believe it or not, we're going to have another segment specifically on muscle memory and the ability of athletes to recover faster if they've been long-time athletes. But he's got the mental toughness in the game saying he's going to come back. But now he's not on the narcotics or the muscle relaxants, maybe even fewer anti-inflammatories, and so he can focus better.
Absolutely.
His head isn't cloudy from all these pain medications. He's not distracted from the pain that he's having. Where I can imagine, like, even if I'm doing surgery, we've all been there. You stub a toe or something while you're on the beach, and then you have surgery later in the week, and you're standing all day, and you have to sort of shift back and forth, and it's a little distracting. Maybe you're a little slower during surgery.
Absolutely.
I can only imagine that with Tiger playing, he has to be so focused on his game, and can you imagine if he has a little bit of distraction? I mean, can hurt his swing.
Exactly. And remember your ACL. He won several events and a championship with a ruptured ACL. So think about this guy swinging, and every time he swings, somebody hits him in the knee with a sledgehammer. That's a hell of a distraction.
Absolutely, absolutely. So, Kris, this was great. It was an excellent explanation. I hope that answered your questions out there. It certainly helped me understand Tiger Woods, and this is going to be an exciting tournament. I'm really looking forward to seeing how he does. I mean, we've got top Phil Mickelson, Tiger Woods, head-to-head, spine fusion. So we basically have multiple injury, multiple operations versus a top athlete with multiple levels of arthritis. They're going head-to-head, and they're the top players in the game.
Level athletes.
World-class level
Exactly.
athletes. So that goes to show how technology has come. We have the medicine and the implants and the technology to get top athletes back in the game. I think this is great. This is what we love about orthopedics. This is what makes it fun, right?
Yes, absolutely. Absolutely. Getting people back to their lives is exactly what I like about orthopedics.
I got bones. I got